We're coming to you from the Gold Coast for the Hills Pet Nutrition Vasava Pre-Congress Kidney Symposium, and we've caught up with Dr. Becca Leung ahead of her imminent presentation on picky eaters. Now, Becca, hello. Welcome. I imagine that there's not a lot of people watching who haven't ever had a problem with a picky eater when a pet has CKD. What can be done?
Yeah, absolutely. So unfortunately, anorexia and nausea are quite associated with once the diagnosis has been made. So I'll talk about a bit more about that in my presentation, but just, being very proactive is quite important. These guys usually can't wait too long before we have to start thinking about assisted feeding. And there's some, drug things that we can think about in regards to appetite stimulants, but there's pros and cons to that to consider as well. There's a few things we can do. Just remember just to be proactive and not to wait.
What about home feeding compared to hospital feeding?
Do you mean home feeding as in home
tube feeding?
Yes, so tube feeding is definitely something in hospital, but we can absolutely send some of those to be sent home as well with the tube in place. Owners are usually quite good at being able to manage that. It's just more about education and getting them confident that they can use it. And it is a bit of a safety net. These animals can have tubes in place for months if needed, and always, there in case we need to top up or something like that. So we definitely have that option, which is fantastic.
Well, that's certainly a lot of food for thought. Thank you, Becca, and we'll be back with lots more from the symposium shortly.